Hi guys, so this is the tutorial on how to achieve the solutions for the Chapter 32 case studies for the O264 course. So we'll go through all of the case studies. I think there's only 5 again. Yeah, 5 for this week. I'm not sure if I assigned you the odd or the even case studies, but this way, whichever ones you weren't assigned, you can work on those extra ones for practice. So for case study number 1, it is a cardiac unit note. 75-year-old female diagnosed with cardiac abnormalities. She's brought to the cardiac unit to monitor her cardiac output using an external monitor. A full report is to follow. So for this, the key word here is monitoring. So I would look up monitoring, and then cardiac, then output for that problem. For case 2, it is a respiratory care unit, 80-year-old female patient having difficulty breathing, respiratory rate varies. She is brought to this unit to externally monitor her respiratory rate. She is to follow up for results with Dr. Khanna. So again, we are monitoring her respiratory rate, so that's exactly what you would look up, is monitoring respiratory and then rate. For case 3, 23-week pregnant female brought to the unit to monitor the cardiac sounds of her child. Sounds were monitored using an endoscopic vaginal monitor. So for that one, again, monitoring is the key word there. And then cardiac. And then I would look up sound. You might be able to find it just with monitoring and then cardiac. Okay, I'm going to pause you for a second while I flip the book. Okay, I got the page flipped. Let me focus really quickly. There we go. Okay, so case 4 is a 59-year-old male, has been experiencing cardiac symptoms. Today he's receiving a Holter monitor for the next 24 hours. He was instructed to leave the monitor on for the next 24 hours while he's conducting his normal activities. He's also to keep an activity diary of his daily events so his activities can be compared to the EKG tracings. He is to return in 2 days. So then for that one's really easy. You would just look up Holter monitoring. And for the last case, case 5 is a hospital note, so it's inpatient, 62-year-old female, stress test 2 days ago, slightly abnormal, family history of heart attacks with both parents. She has presented for a cardiac cath bilaterally with sampling and pressure measurements. Procedure was completed. There are positive findings. Procedure note for details. So the cardiac surgeon has been contacted for consult. So the procedure that has been done here looks like a catheterization of the heart. Okay, so those are your case studies. What I would look up to get started for those. I will tell you that all of your coding assignments are going to come from the section in your PCS manual that is measurement and monitoring. I started working through some of them already. Let me flip this back around. There you go. So I started working through some of them already, and you can see that almost all of them are going to come from that 4A table. And some of them will come, a few of them will come from 4B, but most of them are going to come from 4A for your coding assignments. So hopefully that will get you started and help you out. If you have any questions, let me know. Thanks.